Hello and welcome to the Base Physician Training course. The purpose of this module is to familiarize yourself with the basics of online medical control in Milwaukee County EMS. As a base physician, you play an important role in the care of the population of southeastern Wisconsin. You are an essential component of the Milwaukee County EMS system, which is recognized as one of the premier EMS systems in the country. The Milwaukee County Emergency Medical Services System is a county-wide system covering 241 square miles and serving approximately 1 million people. It includes 19 separate municipalities that each provide their own basic life support services, while paramedic services are provided by a number of dedicated and flexible advanced life support ambulances and multiple paramedic first response units. Transporting ALS units are referred to as med units. Depending on the community, paramedic ambulances are staffed with either 3 paramedics, 2 paramedics and an EMT driver, or 2 paramedics. Milwaukee County EMS also provides oversight for several BLS services within the county. Initial access to the system occurs through a number of enhanced 911 centers in the county. Private ambulance companies provide BLS services privately as well as through contract with the City of Milwaukee. They also provide ALS interfacility transport. They are permitted to initiate non-interfacility ALS care, but must simultaneously request a Milwaukee County EMS unit. Milwaukee County EMS evaluates approximately 31,000 patients a year, of which about 22,000 are transported to a hospital. There are about 1,100 calls for online medical control annually, or approximately 3 calls per day. The Milwaukee County EMS Communications Center is located in an off-site facility. It is staffed at all times by EMS communicators who are licensed emergency medical technicians. The Communications Center receives information on every Milwaukee County Med unit transport and relays that information to the receiving hospital. The EMS Communications Center, or EMS-COM, is equipped to communicate by units with radio and phone, and can also receive cardiac telemetry data. When necessary, a med unit will request an online physician for assistance and/or orders. Your involvement as an online medical control physician is an important part of providing quality patient care. Your role as an EMS online physician is part of the spectrum of medical oversight of out-of-hospital medical care. Unlike physicians or nurses, emergency medical technicians are not independent practitioners. They must practice under the authority of a physician. They are licensed to practice under an EMS medical director who is responsible for ensuring medical oversight. There are 2 types of medical oversight, also known as medical control. Direct or online medical control involves real-time communications with field providers about an actual patient. This may be required by protocol in certain situations, but can also occur if the paramedics feel they need advice regarding patient care. Online medical oversight in the Milwaukee County EMS system is provided by emergency physicians at the Medical College of Wisconsin. In other words, you. Indirect or offline medical control involves all aspects of medical oversight not directly involving a current individual patient. This includes assisting with writing of policies and procedures, developing educational curricula, analysis of data, and quality improvement. Indirect medical control is the responsibility of the system medical directors. There are 4 recognized levels of emergency medical technician in the state of Wisconsin and a first responder level. The medical first responder is the most basic level of first aid. Not to be confused with by a unit first in, Milwaukee County EMS does not utilize the medical first responder level of care. The first level of care in Milwaukee County is the emergency medical technician, formerly known as EMT Basic. The next levels are the advanced EMT, also known as EMT IV technician, the EMT Intermediate, and while there are a few IV techs, Milwaukee County does not utilize the EMT Intermediate level. The highest level of training is the paramedic or EMT paramedic level. Please note that the official terminology has recently changed. The official terms are EMT, Advanced EMT, EMT Intermediate, and Paramedic, which correspond to the old terms of EMT Basic, EMT IV Tech, EMT Intermediate, and EMT Paramedic. Also note that the level of EMT Intermediate is unique to the state of Wisconsin and certain other states, but no longer used at the national level. All firefighters and private ambulance personnel are trained to at least the EMT level. They have completed approximately 140 hours of training that includes basic trauma care, CPR, and operation of an automated external defibrillator. In Milwaukee County, the curriculum for basic EMTs also includes several advanced skills as listed here. Milwaukee County EMS paramedics receive approximately 1,200 hours of training at the Milwaukee County EMS Education Center. They are licensed by the state of Wisconsin and are also certified by the National Registry of EMS or of Emergency Medical Technicians. Paramedics in the system are able to perform the skills outlined below in areas of airway management, IV solutions, and vascular access. As well as these skills in medication administration, cardiac procedures, and special procedures. And these procedures related to miscellaneous equipment. It is important to note that there are several paramedic level skills that Milwaukee County EMS does not universally use. Paramedics in Milwaukee County do not universally provide transcutaneous pacing, place central venous catheters, perform surgical airways, or perform RSI. Certain agencies may perform surgical airways and RSI on a limited patient set. As a medical control physician, you may not order them to perform procedures that they are not able to do independently, even if the situation warrants that action. Paramedics follow protocols and standing orders for evaluating and treating patients and for requesting assistance from the online physician. The online physician not only provides medical authority to administer medications and carry out treatments, but also offers consultation for dilemmas or problems with patient care. As the online physician, you join the paramedic team providing care to the patient. The collegial interaction improves patient care and provides an opportunity for education of yourselves and the paramedics. Paramedics serve as the physician's eyes, ears, and hands in the field. Familiarity with the system's medical protocols is essential. Please review the online protocols. It may take you a little while to get used to caring for a patient over the radio. Ask questions if things are unclear or if more information is required. You also have the ability to request and view cardiac telemetry data and 12-lead EKGs. Directed questions or suggestions improve patient care, but don't waste time asking for information that won't change management. Remember, part of your role as an online physician is to help educate the paramedics. Be sure to provide explanations or feedback when warranted, either on the radio or later by telephone when there is more time to discuss the details of the case. Although you are responsible for patient care, you must work with paramedics in a cooperative manner. Remember that the situation in the field may limit what is possible. Paramedics should not be forced to do anything with which they are uncomfortable. Additionally, paramedics should not be asked to perform any procedure or skill that they have not been trained to perform. It is inappropriate to talk them through a procedure. It is also unacceptable to request medications that are not carried on the med unit. Paramedics are instructed to challenge orders that they are not trained to perform. They are also instructed to question if an order seems to deviate from system policy or procedure. Be sure to provide an explanation if the field providers seem hesitant to carry out an order. All Milwaukee County EMS protocols, operational policies, and general standards of care are available online at the links below. A link is available in the room at the central computer as well. A newer resource that can be of great assistance for both online medical control calls as well as for general understanding of our EMS system is pictured here. The Milwaukee County EMS app can be found by searching MCEMS or Milwaukee County EMS in the App Store on your smartphone. It contains the medication list as well as all Milwaukee County EMS protocols. If you have questions, there are hard copies of the policies and protocols kept at the online physician station as well. Also, EMS communicators can help you with questions about using the radio or system policies. If you have questions about medical care, don't hesitate to call your attending staff physician for consultation. Cases that are especially interesting, problematic, or educational may be flagged for review. In order to be able to serve as an online control physician, it is assumed that you are certified in ACLS and ATLS. You are required to complete the online physician course. This session is the first portion. There is another session reviewing the medical command form. After completing these online sessions and reviewing the physician manual, you must achieve a passing score of 80% on the online test. In the in-person portion of the course, you will engage in simulated radio calls. After completing the course, you will be required to observe 4 actual calls where you will fill out a medical command form, as if you were completing the call. After observing 4 calls, you will be observed as you perform 4 actual calls, at least one of which must be a cardiac arrest case. Once you have completed those 8 calls, you will be observed on an actual call by one of the EMS medical directors. Finally, you will schedule and complete a simulation test with an EMS medical director. After successful completion, you will be able to independently take online medical control calls. When you receive a request for an online physician, you are responsible for responding within 2 minutes of that request. When signing on to the radio, make sure to identify yourself with your physician number. For example, Med 99, this is Doc 1234, go ahead. Speak slowly and clearly, and be careful not to cut off either the end of your transmission by talking without fully pushing the button or letting the button go too quickly. Once you are finished, remember to sign off with your number and the time. For example, Med 99, this is Doc 1234, signing off at 10:30 hours. A very important point to remember, radio transmissions are public. The patient, family, and bystanders on scene are listening to your conversation as well. Likewise, anyone with a scanner can listen to the transmission. Do not use a patient's name or any other obvious identifiers while on the radio. If there is something confidential that needs to be discussed, ask the paramedics to call you directly via a phone line. You will learn more about the basics of a call during the practical portion of the course. This Milwaukee County policy outlines interaction with medical control. It describes when to contact medical control, which includes the instruction of policies in the manual, under special circumstances, and when a patient is deteriorating despite protocols. It also includes how to address the inability to carry out physician orders, dealing with orders outside of protocols, which must be within paramedic scope of practice for them to perform, and when they are unable to contact medical control due to communication failure. The protocol is pictured in its entirety to the right, but may also be found online at the Milwaukee County EMS website. Now we will briefly cover some situations that commonly arise when serving as online medical control. More details will be provided during the practical part of this physician course. The first priority of any call is the safety of the EMS providers and the patient. Stay aware of the limitations of practicing medicine in the field. Sometimes the paramedics may ask to delay an order until they are in a safe environment. This may include moving the patient into the ambulance. The most common calls that you will encounter, from most frequent to least frequent, include cardiac arrest, EKG consultation, ROSC patients, refusals of care, and additional medication requests. If the field providers may call you to discuss a patient refusal of care or transport, as with in-hospital care, you must determine if the patient has the decision-making capacity to refuse care. Sometimes the paramedics are seeking your help to convince a patient to accept care. Talking with the patient will help you to assess the situation and the patient's mental status. If you make the determination that the patient is able to refuse care, the paramedics should have the patient sign a refusal. If you believe the patient is incapable of making a sound decision, you can have the paramedics restrain the patient. Sometimes this may require them calling for law enforcement assistance. Occasionally, the paramedics will call you because a physician on scene is requesting to direct the care of the patients. Remember that as paramedics, the EMS providers are authorized to take orders from you, the online medical control physician. If a doctor on scene wishes to direct care, you must first determine that he or she is qualified to do so, for example, that their specialty is appropriate for the situation. Then that physician must agree to ride with the patient all the way to the hospital, transfer care, and sign the paramedic run report. If all these conditions are met, you may authorize the paramedics to take orders from the on-scene physician. However, the paramedics are still bound by their scope of practice and Milwaukee County EMS policy. Regarding traumatic cardiac arrests, they may be pronounced dead in the field without medical control input if the 5 listed criteria are met. If the arrest is witnessed by EMS and a specific criteria are met, transportation may occur without medical control input. These cases would be exceptionally rare. Otherwise, medical control would be involved, and a reference to the online traumatic cardiac arrest practice guideline may be helpful. Remember that epinephrine is not indicated in traumatic cardiac arrests. It is the philosophy of Milwaukee County EMS that patients in non-traumatic cardiac arrest receive ACLS in the field until they regain pulses or are declared dead. Evidence has documented the poor quality and often unsafeness of CPR in moving ambulances, and the extremely low survival of patients who arrive to the hospital in arrest. Transport of a pulseless patient should only be performed under rare special circumstances. However, do not outright refuse a paramedic request to transport a pulseless patient, as it usually indicates extenuating circumstances. Milwaukee County EMS policy states that resuscitation should not be attempted if there is decapitation or other clearly fatal injury, tissue decomposition, rigor mortis, or dependent lividity. Milwaukee County EMS providers also must honor DNR bracelets and are allowed to honor clear DNR orders and pulsed paperwork. If ACLS efforts have not been successful in restoring blood flow, it is appropriate to terminate resuscitative efforts in the field. Termination of resuscitation is referred to in the Milwaukee County system with the code 1099. If both you and the paramedic crew are in agreement, you may authorize a 1099. Always consider a request to continue resuscitation, as there may be special circumstances that the paramedics are not aware of. Also, you may authorize transport if you feel it is appropriate in certain situations. EMS providers are required to honor appropriately documented Do Not Resuscitate or DNR orders. This may take the form of an official State of Wisconsin blue DNR bracelet or an engraved metal Medic Alert bracelet. Milwaukee County EMS providers are also allowed to honor signed, official written, DNR or pulsed paperwork. DNR orders can be rescinded if the patient requests it, the bracelet or paperwork appears tampered with, or if the patient is known to be pregnant. If a Milwaukee County paramedic starts resuscitation, medical control authorization is required to stop resuscitation. Paramedics will occasionally call to discuss resuscitation when there are family members or a physician requesting DNR. You must assess the situation and make a decision based on your judgment. A power of attorney or POA for healthcare is a document that designates a person who becomes legally authorized to make decisions on a patient's behalf when the patient is no longer competent to make his or her own choices. A living will is a legal document where a patient can list his or her wishes for health care in the event that they become unable to make the decisions. To take effect, both a POA and a living will must be activated by the judgment of two physicians who independently determine that a patient is no longer competent. Paramedics will call medical control to discuss any power of attorney or living will. Online physicians should honor the wishes of a designated POA or living will when written documentation is presented to the paramedics. Milwaukee County EMS policy states that the patient should be transported to the closest, most appropriate receiving hospital. The first consideration is the patient's preference. Paramedics will transport to a patient's preferred hospital unless they believe that additional transport time or the nature of the medical emergency makes it unsafe to do so. Certain hospitals have specialty designations that indicate they are able to accommodate certain patient populations. For example, Milwaukee County EMS designates a system adult trauma center and pediatric trauma center. Hospital specialty designations should be considered when a patient falls into one of these special categories. Usually the paramedics will let you know where they are transporting the patient. Occasionally they will consult you to determine which is the most appropriate hospital. You should consider the condition of the patient and make a determination on whether the patient should be brought to the closest facility or if the situation allows or warrants a longer transport time to a different facility. Please refer to the Hospital Transport Destination Policy for a list of specialty designations. This concludes our introduction to the role of the online medical control physician. If you have any questions, please refer to your online physician manual, which contains more detailed information. You can also ask any of the EMS medical directors. Thank you for your time, and thank you for serving as a medical control physician for Milwaukee County EMS.